This is Anna Rodriguez, and she is a 74-year-old retired lady. Her husband passed away a few years ago, and her 7 children live far from her. Last year, she underwent a CABG, coronary artery bypass grafting surgery, but is fine. On a Wednesday, Anna left home at 7 a.m. to go to the open fair, which is 20 minutes from her house. Upon arriving at Mr. John's fruit stand, she complained of weakness, dizziness, and a headache. Mr. John realized she was indeed not well and called an ambulance. As soon as they arrived on site, the ambulance took Anna to the nearest primary hospital. There, she explained her symptoms to the nurse responsible for triage. While examining the patient, he realized that her speech was slurred and she could not move the left side of her body. He then resorted to the quick examination FAST, face, arms, speech, time, to detect a stroke. The nurse, Smith, picks up his phone and opens the app Join. He opens up a case within the hospital with a responsible neurologist so that she can be aware of the case. Dr. Tuwani arrives and asks Mrs. Rodriguez when the symptoms began, and, reassured by the fact that they started only 1 hour ago, she asks for an emergency brain CT scan. After getting the results of all the tests, Dr. Tuwani confirms the diagnosis and sends Dr. Gonzalez, her colleague and a neurologist at the Comprehensive Hospital, the brain CT DICOM image. Dr. Gonzalez asks Dr. Tuwani to perform a thrombolysis with IV TPA and transfer the patient to the Comprehensive Stroke Center, where he will consider a neurovascular procedure. After Anna arrives at the Comprehensive Hospital, the team is already prepared. As soon as she had NIHSS greater than 6 and occlusion of middle cerebral artery, Dr. Gonzalez prepares the team for an emergency mechanical thrombectomy. After going through the endovascular procedure, Mrs. Rodriguez is fine and recovering. She is taken to the ICU for the rest of the day and overnight, so the team can check her signs periodically. Knowing she will recover, Dr. Gonzalez closes the case in the app. Anna is discharged from the hospital so she can go home and back to her life. However, she still has to follow a few medical instructions for a while in order to assure her full recovery from the stroke. She has no disabilities, despite a few symptoms, and is able to carry out all usual duties and activities. Thanks to the efficiency of Join and the good communication of all the professionals involved, she has no permanent sequelae.